Welcome back to the best health channel on YouTube. Today I will be talking about a sensitive topic, anxiety disorder. As of 2019, anxiety disorders affected approximately 301 million people worldwide. This makes anxiety disorders the most common of all mental disorders. An estimated 4% of the global population currently experience an anxiety disorder. And I am sure that number has gone up since then, judging from the rise in use of social media. Before we continue, what is anxiety disorder? Anxiety disorder is a mental health condition characterized by excessive and persistent worry and fear about everyday situations. It often involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, panic attacks. These feelings of anxiety and panic interfere with daily activities, are difficult to control, are out of proportion to the actual danger, and can last a long time. From med school, I have been taught that before you start any kind of treatment you need to make an accurate diagnosis, and to do this you need to consider many factors like causes, risk factors, symptoms, and then physical and laboratory examination. So, what causes anxiety disorders and why is it so prevalent in young people these days? Before I go into documented and researched causes, I will give you one from what I see every day, which is too much pressure from social media. Many young people are on social media 24/7, and there they see guys and girls of their age claiming to be living a good life and having everything go well for them, and from there they start feeling bad about themselves, having self-pity, overthinking and over-worrying. What other factors can lead to anxiety? Genetics. Anxiety disorders can run in families, as research showed, suggesting that a combination of genes may increase the likelihood of developing an anxiety disorder. Brain chemistry. Neurotransmitters, chemicals in the brain involved in regulating mood and behavior, might contribute to anxiety. Imbalances in these chemicals can lead to symptoms of anxiety. This happens when you are very stressed and don't have a very good sleep. You need to take care of your body for it to take care of you, don't stress it. Environmental stress. This can be from trauma, abuse, a death of a loved one, or relationship problems can trigger anxiety disorders. Chronic or ongoing stress can also contribute. Some of the things here are not really under your control, as it can happen to anyone, but try your best to avoid self-pity. Developmental factors. Experiences during childhood and adolescence, such as bullying, parental neglect or overprotection, can influence the development of anxiety disorders. Many young people experience this, and I want you to know that it is not your fault, but it is your responsibility to seek help. Personality traits. Certain personality traits, such as being a perfectionist, having low self-esteem, or being prone to negative thinking, can make individuals more susceptible to anxiety disorders. Medical factors. Certain physical health conditions, such as thyroid problems, heart arrhythmia, or asthma, can be linked with anxiety. Additionally, some medications can cause symptoms of anxiety as a side effect. Substance use. Abuse of drugs or alcohol can cause or worsen anxiety. Withdrawal from these substances can also trigger anxiety symptoms. Other mental health disorders. Anxiety disorders often co-occur with other mental health conditions, such as depression, which can both contribute to and exacerbate anxiety. It's important to note that the exact cause of anxiety disorders varies from person to person. For many, a combination of these factors plays a role. Understanding these causes can be an important step in seeking effective treatment. Anxiety disorders can manifest through a variety of symptoms, which can be psychological, physical, or behavioral. It can range from excessive worrying. This is the hallmark of generalized anxiety disorder, characterized by persistent and excessive worries about everyday matters. For example, constantly worrying about job security or family health, even without specific threats. Feeling agitated. When anxious, the body goes into a fight or flight response, leading to symptoms like a racing heart, sweaty palms, shaky hands, or dry mouth. This is the body preparing to confront or flee the perceived danger. Restlessness. Often experienced by children and teens with anxiety, this is a feeling of being on edge or an inability to relax. An example would be an inability to sit still during calm activities. Fatigue. This can seem paradoxical with symptoms like restlessness or agitation, but anxiety can be very draining and lead to feelings of tiredness and lack of energy. Difficulty concentrating. Anxiety can interfere with focus, leading to trouble concentrating on work or other tasks. Someone might find their mind constantly drifting to their worries. Irritability. This is a common symptom, especially in children and teens with anxiety. They might have a short temper and be easily frustrated by small things. Tense muscles. Chronic muscle tension, often in the neck, shoulders, or back, can be a symptom of anxiety. This might manifest as frequent headaches or discomfort in these areas. Trouble sleeping. Anxiety can cause difficulties falling asleep or staying asleep. Individuals might lie awake, worrying and ruminating over specific problems or fears. Panic attacks. These are sudden periods of intense fear that may include palpitations, sweating, shaking, shortness of breath, a feeling of impending doom, or a fear of losing control. An example is feeling a sudden, overwhelming panic when in a crowded space. Avoiding social situations. Especially seen in social anxiety disorder. This involves avoiding social gatherings due to feelings of self-consciousness, fear of being judged, or worry about being embarrassed. Irrational fears. In phobias, a person experiences intense fear about a specific object or situation, like fear of spiders, arachnophobia, or fear of being in enclosed spaces, claustrophobia. Gastrointestinal problems. Anxiety can affect the stomach and intestines, leading to issues like diarrhea, constipation, or nausea. It's important to recognize that these symptoms can also be related to other medical or psychological conditions. Therefore, a thorough evaluation by a healthcare professional is crucial for an accurate diagnosis and appropriate treatment. If you have 4 or more of these symptoms, I suggest you visit a doctor that is specialized in mental health disorders for proper diagnosis. For treating anxiety disorders, various medical and alternative treatments are used. Now, before I talk about medical treatment, I want to talk about alternative methods which you can use to manage this for those that don't like taking meds. Relaxation techniques. Meditation, yoga, and other relaxation practices can ease anxiety symptoms. Let me talk more on this. Most of us overstress our brain by overthinking, over-worrying, not having enough sleep. You are simply punishing your brain. Let me tell you a practice that changed my life. Meditation. I remember starting this and it felt like I was wasting my time. I heard a lot about it that I expected something supernatural to happen. I remember I quit many times because my brain was jumping from one place to another and I felt I was not doing it right. But here is the secret. Meditation is not about your mind being quiet, as it is impossible for that to happen, but to be aware, to observe your thoughts, be aware of what you are thinking. I meditate in the evening before I sleep. I think about all the things I did in the day. Give thanks to the higher source, and I do this while focusing on my breaths and making sure all the muscles on my face and head are relaxed. This really works wonders once you get the hang of it. Herbal and tea remedies. Some herbs have been studied for anxiety treatment, but more research is needed to confirm their efficacy and safety. I never really understood the concept of drinking tea, and by tea I mean green tea and others, until I started taking them. Trust me, they have very calming effects. Dietary adjustments. A diet focusing on vegetables, fruits, whole grains, and fish may help reduce anxiety. I am not telling you to be a vegan, but adding more fruits and vegetables to your diet goes a long way. Support groups. Joining groups where individuals share experiences and coping strategies. I honestly don't believe in this because it is not my thing, but it works for many people, so give it a try. It might work for you. Journaling. Keeping a track of personal life to identify stressors and effective coping mechanisms. Honestly, this was stressful for me at first and required a lot of discipline, but I decided to make it fun. So I journal by writing a letter to my future self, telling him what I did that day, my new ideas, what I am thankful and grateful for, and other stuff. Time management. Learning to manage time efficiently can reduce anxiety related to overwhelming schedules. Honestly, I think it increases my anxiety. But here is the thing. It is not about time management. It is about being organized, cleaning up your space, getting rid of things you don't need, having a to-do list, and planning your day from the night before. Having a list of things I need to do makes me calm, and I don't rush to finish everything on my list. I do my best and continue the next day. The goal is to be consistent and be steady. And please get enough sleep. Your body is doing a lot of work to keep you alive, so give it time to rest. Medical treatments include 1. Psychotherapy. This includes methods like cognitive behavioral therapy, CBT, which helps in changing thought patterns causing anxiety. 2. Medications. Antidepressants, such as escitalopram or duloxetine, and anti-anxiety medications like buspirone are commonly prescribed. 3. Benzodiazepines. Medications like alprazolam or clonazepam provide immediate relief but are generally recommended for short-term use due to the risk of dependence. 4. Lifestyle changes. Quitting smoking, reducing caffeine intake, and avoiding alcohol can help mitigate anxiety symptoms. Dealing with anxiety can be challenging, but it's important to remember that there are many paths to better managing and overcoming this condition. Whether through medical treatments, lifestyle changes, or alternative therapies, there is hope and numerous options available to improve your quality of life. Each step you take, no matter how small, is a positive move towards a calmer, more fulfilling life. Remember, you are not alone in this journey, and with the right support and strategies, you can find relief and regain control over your anxiety. Stay hopeful and keep moving forward. Please like, subscribe and share this video to help someone.